Well, I hope you're doing well. I got a number of topics today. You know the drill. You have a question, put it in the chat. If the question is burning, it has to be spoken by all means. Raise your hand. We'll make sure we'll give you time to ask the question. So, first of all, a little bit of a COVID-related topic, and that is the relationship between the COVID and the gut. So those of you who've had COVID in the last, I would say, 12 months or so may have had a situation where you've had diarrhea, bloating, constipation, gas, etc. for months after the COVID. So if anybody care, please raise your hand if that happened to you, because it would be good to see some statistics in this small sample of 21 person. But I have seen this probably play out at least in half a dozen of my patients. Some patients had these symptoms for over 6 months, although I would say that everybody gradually improved, although it just took a long time. So what's really cool is that it turns out that it is more of a temporary effect. Doesn't seem to stay present in everybody. So if you are one of the unlucky people who's going to get a severe long COVID, and by default, if it's something that lasts for, I think, more than 3 or 4 months, you can call that a long COVID symptoms. But it looks like this particular issue does resolve over time in everybody. It's just in some people it resolves over some weeks, and in some people it resolves over many months. But it does resolve. It's probably due to, at least in part, to a microbiome change. Microbiome can improve. And it does improve after a while with a good diet and maybe even some probiotics. So although I think there's no data and it's controversial in terms of using probiotics. The only thing I would add is that if that happens to you and you are noticing symptoms, what you can do and what you should do, you should basically treat this as based on a symptom. So if you're having more of a diarrhea, you could try to use a bit more of a less fiber diet for a while. You can, if you're having constipation, on the other hand, of course, you can treat that. That seems to be the simplest way to address it. Now, if it doesn't go away in some reasonable time, then you would, of course, want to be a bit more aggressive and have it talk to your practitioner, talk to your provider. So that's the first topic. The second topic, I was going to talk a little bit about the fact that we're entering really the cold time of the year, and sort of how do I think about and what do I do personally about it, and how do I cope with this? So obviously, when we're cooling off and our body suddenly drops the temperature, you are lowering immune system if you're not trained to the lower temperature. I'll come back to that in a couple of minutes. So it's expected that in a cold weather, there is more viral infections, not only because the immune system can drop, but also because we're more indoors. Obviously, we're more exposed to passing viruses back and forth, and hence the same applies to COVID as well, right? So historically, in the last 2 years, we have not seen spikes in the middle of the winter. I don't expect this year to be any different. I think the next spike will start as predicted, sometime in the late spring or mid-spring. Why it is particularly this way, that's just the natural course of the viruses. But of course, there is some risk that COVID even can resurface back in the middle of the winter. So that's also possible. It's just not what the current predictions are. So what do you do? Well, first of all, if you're naturally cycling through increased amount of sleep, which is intuitive, right? I mean, it always feels like when the weather is off, when it's raining, when it's snowing, when it's cold, you feel like you want to sleep more. There is some intuitive truth to that. The science is kind of funny about it. The science says there's actually no evidence to that. However, I think in our own lives, we're all quite well aware that we do change the sleep pattern when the temperature changes. I highly encourage you to flow with that. So don't force your alarm to wake you up earlier if you can. If your schedule allows you to sleep longer, sleep longer. That natural cycle is evolutionary, and we need more time to recover in a more stressed environments, right? So whether you're in more cold environment, or you just, I don't know, you exercise a lot, or you have some stress in your life, it's expected that you need to de-stress, that you need to recover longer. So there's nothing unusual about that your body is saying, I'd like to sleep longer. Okay, so there's a concern that my voice is distorted. Is that for everybody? Okay. Jacqueline, I'm not sure if it's, you may want to leave and come back.
Okay, it may just be me. Okay, thank
Something
you.
you can do then. Because sometimes it's your connection, not mine. If everybody else hearing okay, then it's not me. Okay, let me come back, go back to where I was. So that's the first thing. So don't be afraid of allowing your natural rhythm to tell you that, okay? It's exactly the same applies to the foods. We already had several people come and talk to us about, like Tiffany Hoyt, for example, talked about what do you, from Chinese perspective, how you should be eating when the weather changes, right? So in the winter, we obviously craving more warm foods. I see Jennifer is sipping her hot tea. So those are the things that we naturally craving, and it's totally fine. And actually, that's what you should do. So try to minimize cold foods during the winter. So particularly, well, you should never be drinking ice cold water with the meal. Simply because it's really bad for your digestive tract. You're shutting down enzymatic activity when you're doing that. But in the summer, like between the meals, right, when it's hot, you just went for exercise, you come back and you feel like drinking cold water, sure, that's fine. But in the winter, you probably don't want to do that because the body is already cold. Even if you exercise for a period of time and you feel hot, it's probably not a greatest idea to suddenly cool the body. The nature, so to speak, will do it for you. So you could potentially just simply drink room temperature water. But I actually recommend that you get used to drinking pretty much, warm drinks, not necessarily hot, but the warm drinks. And the same goes with the foods. So you may want to, instead of eating more salads, making more vegetable soups, making more steamed vegetables, making things that are slightly thermally prepared so that the food is a bit warmer and it's a bit more pre-digested. So that's another important concept. I love drinking bone broth in the winter, particularly for same exact reason. Usually we would drink it warm, and we would often use it as a stock for the vegetable soup. So you take that bone broth and you add vegetables to it, and you reboil it, and you let the vegetables cook there, and then that's your soup. And sometimes we would make it for quite a couple of days, and it'll just sit in the fridge, and then we'll sort of keep consuming it. So that's another one. Now let's talk a little bit about the exercise. The exercise in the winter doesn't necessarily have to change. So it depends on what you kind of like doing. If you're doing a lot of gym and classes like yoga, Pilates, I don't think that's really is up for a change. But if you are an avid naturalist and you love to go and exercise in the nature, you may need to do some adjustments. That could be a bit tricky. So if I am preparing right now for that ski race, and it's really, really wet outside, I can't just go and train. I can't train on wet asphalt. It's too risky. So, you could potentially modify it. I strongly encourage you not to drop being in the nature, no matter what the season is, because I think it's very energetically good. I think it's perfectly fine for us to put our body in whatever the temperature is, and we're going to talk about the temperature of the body in a little bit when we talk about cold training in a minute. But don't be afraid of that. But of course, you may need to use more layers, and you also may need to learn a bit more of exercise clothing. That is a very interesting aspect, and often people don't know about that. So for example, usually when you're doing any kind of endurance, anything, walking, running, biking, jog, whatever you're doing outside in the cold weather, you want to have 3 layers. You want to have an under layer, the layer that goes on the skin. So usually that would be either a pure cotton, merino wool, which would be a way higher grade, very expensive, and sort of thought to be the warmest one. But not a lot of people like wool because it sometimes itches and irritates the skin. Most of the current undergarments, what they're called, are synthetic. That's what I usually wear, mostly because, they tend to take the moisture from body the fastest, and they also tend to maintain much higher amount of capacity to remove the moisture. So the second layer is your kind of in-between layer that's usually depends on the severity of the cold. So if the temperature is not very cold, you may even lose the middle layer, or just have something really, really thin. But if it's really cold, then you would have like a warm fleece in between, or maybe even something thicker, like a full thickness, high grade wool warmer of some sort. And then the third layer is a windbreaker mostly, and there's tricks to that. So if you're expecting to be pretty sweaty, if you're not just slowly walking, but let's say you're running or you're biking at pretty decent effort, and of course, if there are any fellow skiers here, then if you're cross-country skiing, that's pretty engaged activity. So you have to have that layer breathable. If it's not breathable, if you buy one of those cheap fall rain protecting gears, it's awful because it'll block the moisture coming out. You'll get wet inside, and that's the worst that can happen, because if you stop and it's really cold, you're going to freeze down. You absolutely don't want that. You want that top layer to be fully breathable. There's a lot of different coats, a lot of different jackets for that. I do recommend for you to learn this a little bit, because there are also all kinds of different materials. So usually nowadays, if you're doing anything semi-competitive, or if you're expecting a pretty significant effort, you're probably going to buy something synthetic. I don't think there's any natural. Well, there are some ice, I think it's called icebreaker tops, the upper layer. They run very expensive, hundreds of dollars for sure, and I'm not sure how critical that is. It's not even touching your skin. I would say if you really want to wear something natural and you're just like refusing to wear synthetic, just use that on the first layer or on the body, right? And then everything else goes on top of that. It's not touching your body. So whether it's a synthetic or not, there's less concern if you're really that concerned. I'm not. I don't think that there's sort of a data out there to say like wearing synthetic on your skin is going to be harmful to you. I think that's a lot of this is a kind of a, I don't know, a myth, if you will. Okay, so that's that. And then the two other components. The first one is, of course, supplementation. I definitely I'm much more aggressive in the winter with multivitamins, primarily because the demand is higher, right? So even without extra training, like even if I don't train, I may take more B vitamins and more multivitamins and more vitamin C in the winter, just because I know demand is higher during the cold temperature. If your diet changes in the winter, for example, you're like, okay, I'm really not going to eat salads because I really don't want them. That's me too. I eat a lot less salads in the winter, just naturally. So I sometimes would supplement with a green powder. I definitely increase amount of green tea that I consume in the winter dramatically. So usually a couple of cups a day for sure, if not more. And I would rotate between, say, just a high grade leaf tea, which is what I was just drinking. There's just a little bit left. It's cold already. And then I would also do a matcha probably once a day. I'll try, because the matcha is more concentrated. I drink matcha more earlier in the day, and then I would drink the rest of the like a lower potency green tea, maybe upwards all the way up to about 5 or 7 p.m. The tea doesn't tend to keep me up at night. It's a different type of caffeine, and there's a little bit less of it compared to coffee. But still, if you're very sensitive to green tea, well, then you can't really consume that. So then find another warming, powerful antioxidant drink. Maybe it's a moringa. I'll put that in the chat. That's a great powder. It's very potent anti-inflammatory. I'm okay. I don't like necessarily the taste of it. Some people love mate. It's another type. I think that's how we spell it. That's a South American type of like green tea, very high in antioxidant. I mean, that's fine as well. So whatever, thanks, Jennifer. So whatever it feels that gives you this really high plant-based antioxidant content in a warm setting, I think would be really wise. So, okay, I'm at 2:20. It's a good time to start doing questions. And I see that there's some questions popping up. But before I do that, the last point, which I promised you. So I actually do more cold training in the winter than I do it in the summer. I know you don't want to hear this. I totally get that. I don't want to hear this because it sucks. It's awful when it's cold outside. You roll out of the bed and you have set your temperature if you correctly sleeping, definitely 68 or even less. So sometimes our temperature would be at 62. You roll out of bed and you're like, I don't want to get out. And next thing you go, you stick yourself in a cold shower. That feels like I get what's the word? Masochism. I think that's the right word for this. But trust me, you will be surprised after a couple of weeks of doing that, how well you will feel. And that is probably one of the best way to protect against this fluctuating temperatures and the evolving viral infections when the immune system rapidly drops, when you get cooled down. If you train your body, then you will feel a whole lot better and less likely to get those colds. There's actually enough evidence to support what I'm saying. What I'm saying is not all sort of loosey-goosey. There's enough evidence for that. Again, if you're just doing a cold shower, it's not cold enough, but it's cold enough to get some benefits. So I recommend you just do that. If you're like, I am not doing ice cold plunges, forget that. That's for crazy people. Fine, that's for crazy people, not for you. You're not a crazy person. Just do the cold shower. Trust me, in the winter, it's cold enough. Most of the time, you will get under 50 degrees and some high 40s, like maybe 48 or something. So that would be cold enough. And if you rock crazy and you have a full cold training program where you're sticking yourself either in one of those fancy cold tubs that is controlled with an electric thermometer and the whole system, or you're just doing your own, just dropping ice in a tub and all that, that's fine too. Of course, that's perfectly fine. And I think that's all I wanted to say. So I know there's questions. Let me go to chat and let's do questions. Okay. Silk underwear for course. Yeah, so it's the silk underwear is not very warm keeping. It's very decent. It's a kind of very expensive. It doesn't it whisks the moisture, but it's not a really good layer. So if you look around that sort of athletic wear, that's rarely that you're gonna see anything silk. Silk is more fashionable. Silk feels a lot better on the body, but I don't really think of it as it's really good to sleep with, but I don't think of that as an athletic or as a sort of the exercise wear. There may be some products that mix silk with other materials. That is very possible. I haven't really researched this enough to sort of. Okay, how do you feel about drinks like Ensure for vitamins? Awful. Definitely Ensure I feel awful about. There are better forms of Ensure. I'm not an expert on this topic. The problem is simple. Most of the time when you put vitamins in the liquid form, they're all gonna oxidize. And if you don't want them to oxidize, that means they're gonna be in a poor quality synthetic form that is not processable well by your body. And that is the big concern. You don't want to buy vitamins in a liquid form most of the time because they're just very difficult to produce for stable conditions. So if you look on the label, that particular liquid drink with a bunch of vitamins has a year shelf life, never consume it. Chances are it's awful. There are probably some preservatives, colorings, synthetic vitamins, and other crap that doesn't belong in our bodies. Now, it's a different story when you're using these drinks because you're quite sick and your doctor told you and you're trying to sort of rebuild and you need a lot of calories in the concentrated liquid form. Again, there are better products out there than Ensure. There are products that start with a powder and then you reconstitute. That is what you should be doing. I don't recommend anybody buying pre-made drinks outside of the fact that if that's what's convenient and you don't want to deal with making stuff, okay, fine. But it's way better to buy a powder that has all kinds of good vitamins, and powders are pretty stable. for say 6 to 12 months, and then you reconstitute with water, or if you don't want water, you can reconstitute that with something like oat milk or or things like that. I hope that answers it. Okay, if you get a virus this season and it isn't COVID, well, that's a great question. No, so you won't. You will only have immunity against that particular virus. But the thinking is, it's rare to have back-to-back illnesses. That has nothing to do with specificity of the virus. That has more to do with once you went through a period of revving up immune system. So you're acutely ill. The immune system is going to rev up for a period of time. It's going to sort of get you quickly better, and it's not going to cool off instantly. It'll take some weeks before it kind of trickles back into the baseline. So for that period, you're going to simply have a bit more activation in the immune system. So when something comes through and you get exposed to another virus, the system combats it a lot better. So can't do cold shower till hot shower first. All right. Well, everybody have a different willpower. What can I say? It's okay. Yeah, so no, you still have plenty of benefits. Totally go ahead and do the hot shower first. And then if you're doing it this way, it's actually really good to do a couple of rotations. So do like 30 seconds cold, 30 seconds warm. That's a very old traditional naturopathic recommendation. They just call that hydrotherapy. It's not really a fully cold training because you go through this periods of warm water there. But basically it's a different principle. What you're doing here, you're not cooling the body, you're alternating temperature. So you're training the vasculature to constrict and dilate, constrict, dilate, constrict, dilate. So that helps, that's an actually vascular treatment. So it helps to maintain vascular compliance. It helps to keep the blood pressure lower. Like it all has these benefits. But if you're doing it this way, that's fine. Just make sure you end on at least 30 seconds of a cold at the end. Maybe better to a minute. And then you're kind of doing both hydro and the cold training at the same time. 6 cold shower benefits from Misha. All right. Thank you, Janet. Appreciate it. Oh, yeah. Thanks. We had how did I forget about that? So we had a great podcast about moringa. So tune it in if you like the SoundCloud or your podcast on iTunes. By all means, use either system. All of our podcasts are on any of your favorite podcast platform. Thanks for reminding. What general precautions do you take and recommend to avoid getting, for example? So we really talked about this all multiple times. No, at this point, we don't recommend that. Yeah, you mask up when you're in crowd, for sure. That's a good one. You avoid activities that are not necessary. So let's say that you liked going shopping during a very busy time of the year, and you feel weird going there with a mask. Okay, don't go. Pick a time when there's not overly crowded and go at a different time if you're uncomfortable with mask, or just wear a mask. That's another one. Okay. Yeah, so yeah, so there are definitely some probably products that contain silk. Again, I'm wondering if they're mixes, if they're not pure silk. Pure silk and they worm. Okay, well, so research this. That's my point, is that I don't, this is not, I'm not an expert in the clothing, but, point being is it's important to understand the basics here, because a lot of the times people don't think about that. They'll just kind of throw the layers on, but you need to think about the layers in that particular, if you skier, if you downhill skier and you go for a full day of skiing, you put the wrong clothes, you pay for it dearly. You'll do it a couple times, then you'll learn the right clothing and you'll stick with it. No, I don't worry about oxalate load at all, because C gives you very little oxalates. And remember, we just talked about this. If you're cutting down some vegetables, so then it should be okay. I mean, if you're super sensitive to oxalate, you may have a different scenario. You may have a little bit of a different issue altogether. And then if that's the case, then yeah, then you may need to sort of keep the vitamin C dose in check to avoid oxalate. Good point, actually. I was responding first as me personally, right? So I don't really have problems with oxalates personally, so I'm not necessarily thinking about it. But if you are, then you need to keep an eye on that. Yeah, I love that. So I think CJ's saying, what about the warm aqua aerobic classes during? That's awesome. That's wonderful. I mean, again, it's always better to sort of think of it this way, right? Like what exercise could support natural cycle. So kind of a more gentle, warmer exercise. Yeah. When you have to come out in the cold afterwards. Well, you want to just wait a little, right? So you want a body to acclimate. You want a hair to dry out. That's a great question, actually. You want a hair to dry out before you go to the cold, or if you can't, if you don't have time, wear some really thick hat, or practice cold training, and then you won't care, right? So one or the other. Either make your body way more resistant to the effect, or cover up. I mean, that's the basic. All right. Whatever the sun protection to use high elevation. I think you should just keep that in mind and use the same principles of sun protection. It's actually a good point. If you're in, particularly if you're in a higher elevation during winter, you may actually have a higher level of exposure to the UV. And so you have to be more careful. Actually, that's a very well-known phenomenon. You know who get burned one of the worst is the skiers who don't who ski without any kind of protection. So sometimes they get burned really badly. So yeah, you just need to know about this and sort of think about this up front and use the same protection methods. I don't really think that you need to do something specific though. Okay. Well, I mean, Linda, I think if that happens to you, you should just not go out. You don't want to keep infecting people out there. I think that would be good. All right, Dr. Ashraf posted something. Let's see, what did he put in? Right. So that's a great one. So somebody is actually positioned it in reverse. They're saying, okay, does the cold exposure makes you more likely to get weakened immune system? So, there's a whole article in there. Go check it out. It's great. If I did downhill skiing, I'd be paying with a lot more than cold. Okay. Personal opinion, no comment. The mind body. All right. So, all right. Oh, so the podcast on Moringa is in the our GW Integrative Medicine podcast series. So I believe Janet posted the link above. Yep, like it's above posted in the link to the SoundCloud. But again, if you're not using SoundCloud and using other types of um, systems, like I mentioned, if you have a podcast on your iTunes, that's fine. You even can use it on the Spotify. So I think all the podcasts are now kind of randomly on all kinds of platforms that people use. All right, so we're at the minute 35, and I'm hearing from Janet that we don't have our mindfulness teacher here. So Janet, is that confirmed?
Let me look one more time. Larissa, if you're here with us, I would love to spotlight you. But it does not look like she is here.
All right, well, how about this? Let's go a little bit longer with the Q&A. And what do you guys think of last week's Buteyko method? Okay, so well, okay, Jennifer, you always have thumbs up. I want to hear other people saying something. Do we want to do another
Go ahead
round
and
of
mute
it?
yourself if you want to give your
I'm a
opinion.
terrible pessimist, but I did follow up on the Bottega, however you say that, breathing method and improved my number. So I think it helps.
So do we want to
How far do you go? I mean, you go like all the way up to a minute or something.
So you want to go to the normal level of holding on exhale, which would be 30 plus seconds. That's considered normal. So if you got into 15-30, that's a great place to be. So,
Yeah, that's a way to go.
yeah. Okay. All right, so I'm not hearing any other opinions. So we could do that, or I can lead something else as well. So, but okay, so I'll give people 2 more minutes and then we'll do another minute or so of questions. And then we'll do that. They're bothering me from the hospital, so I'm sorry that I have to do something there for a second. On top of all the general problems, there is a residents' strike that happens next week. They couldn't agree on terms between the residents. The residents are physicians in training. So. All right. Okay, RSV level is much higher in DMV now. I was told, but I'm conservative. No, there wouldn't be. I mean, the RSV natural treatments would just be the same as you would use for any other viruses, you know, which would be more like immune optimization, which we just talked. Definitely some zinc, definitely some vitamin C. Immune mushrooms, which I'm a big fan of for viral infections. Echinacea is fine to use. Particularly echinacea is really good to use as a tincture so that you kind of swish and swallow. I think echinacea's best effect is direct contact. So it just decreases chances of virus getting in, so to speak. You know, elderberry is fine. I mean, so they're all these herbal products that tend to kind of boost immunity. It's probably totally fine to consume all of them in whatever your preferred placebo-like boosting effect at the beginning of the illness. I would definitely use something like Ganmao Ling or something similar, which is the Chinese formula that tends to push the acute infections through really quickly. I'm not an expert here, so if we want, we can bring back either Tiffany, Angela, or Ashley or Deidre to talk about this. That would be perfectly fine to cover that topic. Well, so the mushrooms, there's a host of mushrooms like reishi, for example, shiitake, cordyceps, and others that tend to rev up immune system to some degree, and they've been studied quite heavily against acute infections as in immune boosters. So yeah, usually I don't recommend to sort of cherry pick them. I just say, look, get a decent mix. Most of the time I recommend Host Defense, either My Community, which is a really good product. It's a well balanced for general purpose. And then also there's this called Stymit 7, which is another kind of a mixed product. If you like to take tinctures, you can get them in the tincture form. Tinctures are a little bit better because they're more concentrated. But if you hate the tinctures and alcohol, of course, take some capsules as well. And I think that's fine. I'm going to put the name of the brand that I like here because it's available everywhere. That's the name of the brand. Steinmetz Paul Steinmetz is the founder of the company. So the Steinmetz 7 is one of his products that he likes himself to use quite a bit. It's a nice blend. One of the most powerful antiviral and anti-cancer and also immune boosting mushrooms is called chaga. So then there's also something called salajit. Sometimes it's called fulvate, I think in US. In Russia, it's called mumiyo. So that's a very unique kind of a mixed Siberian / Ayurvedic herb. Well, it's not really an herbal. Nobody fully knows what that is. So yeah, so there are other immune boosters that are really potent that you can try, but again, I think we can spend a full hour here talking. Yeah, so fulvic humic, right? So sometimes they come together, but they're two separate molecules. So I don't necessarily adjust vitamin C for winter. I simply say get a gram or so at least per day in divided doses. If you're acutely ill, you can bump that up to 2 or 3 or even 4 or 5 grams. Of course, again, if you're tolerating oxalates easily, otherwise you can cause some issues if you take too much C. Yeah, and definitely divided doses. C has a very, very short half-life. The tablet of vitamin C you ate will be completely gone in 2-3 hours. So there's no point taking large dose once a day. So you want to spread it out. Yeah, so this is a whole separate topic about topical cannabinoids. So maybe we'll cover that in some other day. But thanks for the question because we're running out of time. And I do see Salome has a hand. Salome, do you want to unmute and ask your question?
Yeah, and I'm not asking a question. Well, in a way, it's a question. Since COVID, I've been doing this superfood master mix, which are all this kind of mushrooms. And I continued using it like 3 times a week. I just put it in my oatmeal. It's in a powder form.
Is it working well for you?
I don't know. I haven't had a cold or flu or anything, but I do also do my vaccines.
Or maybe it works for you. Yeah, so stuff like this, I'm actually quite supportive of that. I mean, as long as the product you're getting is a quality product, that you're not buying some poor quality product.
It's made by Kalabashti, Dr. Sunyata Amen, and you can all get it online. She has different kinds.
Okay.
I trust her. Okay, bye-bye. That's all.
All right. Okay. Well, let's do some mind body then. All right. So get yourself comfortable. We'll do what we did last time, which is a Buteyko method. If you were here last week and you've done it, my recommendation is start immediately wherever you're comfortable, but do test yourself first. So it's always good to test what you're comfortable on today. So what you do again, you set up your clock for the stopwatch. You inhale, exhale, hold, and record the timing. Interesting that even little practice, and there's a big difference. So I just did 30 seconds versus I think 24 seconds last week. Same exact thing. I only practiced it a few times a week this past week. So if you just gotten, let's say, if anybody cares, throw in the numbers, what you got. So then what I would propose that when we start in a second, you start immediately with that. So if I got 30 seconds, then I could start with a 15:30. So Jennifer, if you got 28, you start with 14:28. So if you got 35, start with like 17 and 34. Linda, if you got only 20, so then you start with, or is that 26 on exhale? I don't know what 19.26 means. If it's 20 seconds, start with 5:10. So inhale on 5, exhale on 10. Right. So start with even 4:8. Do you count the process of exhaling or just? No, you're just exhaling. There's no holding. This is different. So you're basically exhaling for the length of your hold. So if you just were able to hold for 20, let's say, then you're going to inhale for 10 and exhale for 20. And then what I'll do is we'll do maybe like 2 or 3 minutes first of wherever you are. So if Kathy is at 35 again, she's going to do 17:34. And then I will give us like a couple of minutes and then we'll move up. And you keep moving up to a comfort zone. Let's say that Kathy started at 34 exhale and she got to 40 and she's having a hard time pushing further. Do not. If you can't even do 34, for example, if it's possible, then drop down. So then do 15 and 30, for example. Okay. All right. So let's find this. Let's find a comfortable position. If you need to, don't lay down for this. This is better to be done sitting. I think holding breath while laying down is a little different practice, and exhaling in a laying down position. So we're going to do this seated. Okay, so a couple of intra breaths. Find comfortable place. If you need to close your eyes, close your eyes. If you rather keep them open, that's fine. If you keep your eyes open, my suggestion is unfocus them and place the focus outside of the window if you're by the window. If you're not by the window, pick a spot on the floor and kind of diffuse your concentration and let the eyes relax so they're open, but they're not particularly looking at anything. If you're looking through the window, look further out. Look at maybe a sky or horizon if you have it, or like at the farthest spot you can observe like a tree or something in the distance. And let's begin. So inhale with whatever your timing was. For me, it's 15 and exhale for 30, and we'll do that for about 3 minutes. And if you struggle, like I'm just realizing I'm struggling, just drop it. So go down. I'm going to go to 10 and 20 right now, because at 15 and 30, I couldn't even complete 25. So I'm going to do 10 and 20. Just one more time. We're making the exhalation twice the length of inhalation. So we're counting. And typically, if you're completely native and naive to this practice, you've never done it before, you want to start with 5 and 10. So you inhale for count of 5, and then without any pauses, exhale for count of 10, and you keep going in that circle. No pauses, no holding breaths before or after inhale. That is, I can extend much more. That's great. That's what you want. There's nothing wrong with that, Jennifer. You want to extend you want to teach your body to extend exhalation as much as possible. You don't need to extend inhalation. There's no reason biologically. Let's go back to the practice. So wherever you are, now we're at about 3 minutes. So go ahead and shift up and keep on shifting every minute or two. If you don't have a time, just maybe do 3-4 breaths and then shift up after each third or fourth breath. And shift by 1 count, just to, so you will shift by 1 count on inhale and 2 counts on exhale. So if you've done, like me, 10 and 20, you will now will go up to 11, 20, 22. If you reach the natural ceiling, meaning you kept trying, let's say you've gotten to something like 30, let's do 20 and 40, and you just can't get past that, don't worry about it. Just keep practicing that limit for a while. Usually anybody will reach a limit very quickly in the first couple of days of this practice, and then you will gradually start shifting the limit upwards. But take a recommended getting to a 30-60. That would be constituting a much better health all in all. It's going to be hard to do that. But, get at least to 20-40. I think that would be a really, really good start. The other thing, if you starting inhale is not a problem, but if you're starting an exhale too fast, you will notice you'll empty your lungs way before count is over. You're not doing this right. The whole point is to really learn this slow, prolonging exhalation. So you're really thoughtful about how you're counting the part of exhales. So keep on working on trying to make that exhale very, very slow. So you don't sort of exhale and then pause for another 10 seconds. That's not doing it right. this practice is also great to realize how much air left in the lungs. So if you got into 30, for example, or close to 30, pay particular attention towards the end of exhale and keep on forcing air out. You will learn quickly that you got a lot more air left there. So it's a very, very good practice to learn that full inhale and exhale. And my suggestion is stay more in tune with diaphragm. So you may want to feel that exhalation is not all done through the rib cage, but that your diaphragm is also working. So one way to do this is when you inhale, put your hand on the belly and feel the belly rising. If that's happening, it means you're moving diaphragm more. But you are inhaling deeply through both the diaphragm and the ribs. Ribs are working too. If you're noticing suddenly feeling really, really tired, don't worry about that. You're just simply hyperactivating parasympathetic tone. That happens quite a bit, especially if you have not used to deep breathing techniques like this. All right. I think that's good for today. We're a couple of minutes out. I want to see if anybody has any reflection on this, see how you like this. We could do more of this. I think this is a very, very profoundly important practice. You don't need much to practice this, couple of minutes a day. It will build capacity quite quickly, just so you know. 5 minutes a day of doing this. And you don't have to, every time you come back to this, you don't have to start from 5:10. Just if you're at this point comfortable, let's say at 15:30, just start right there. And this way it'll be quicker to keep building up gradually. Just don't rush this practice. It needs a lot of time. It's not a slow occurring practice. Jennifer.
You really advise not doing it lying down, because I've used it before sleeping.
That's fine.
Okay.
No, it's fine. It's just one thing is if you're doing it that way, you're probably going to get really quickly sleepy. That was my point.
Yeah.
Because it's when you're laying down and it's a very strongly inducing technique, then yes. Okay, so Janet, thanks so much for reminding me. Again, if you're interested in helping AIM is entering in a very specific point in time where we're trying to secure significant grants and restart activity. We're looking for volunteers, and we need particularly help with helping with the Instagram, Facebook, and other communication channels. So if you are interested, please contact Sachi. Sachi is our student representative. She's a master's in public health student who is absolutely amazing. And so let's talk about the holidays, right, Janet? So I'm not here next week. I'm on vacation. Of course, after that, we don't have 2 more weeks because it is vacations, Christmas and New Year. So basically what that is. I also surprisingly, so on the January 3rd, I'll be in Maine, actually in Vermont, observing University of Vermont chronic pain program. I may end up having time and we'll be able to join, but if not, I hope we somehow feel that, because that would be after holidays and we should have the 3rd, right, Janet?
Yes, correct.
Well, actually, I'm not missing then anything because the 20th is the next Friday and we're not having it, right? Because it's already pre-Christmas, we're canceling.
Yes, so the last 2 weeks. So next week and the week after, we will not be meeting.
Okay. All right. So yeah, so if something is burning, you have questions, email us, that's fine. We're still here, not going anywhere. Otherwise, we'll resume on January 3rd. If I'll be, I hope I'll make it. If not, I hope we'll figure something out. In the worst case scenario, we'll have to cancel the 3rd, but definitely I'm back after that. All right. Enjoy holidays.
Thank you. Thank you for everything this year.
Sure. Eat a lot, sleep a lot, exercise a lot, do everything a lot. It's festivities. Make your Christmas tree, if you have one, shine, or if you have a whatever else you may have, whether it's a menorah or anything else spiritually inclined, we send you love regardless, all of it. And if you just like me, who is kind of doesn't care what moment you can celebrate, and you celebrate pretty much everything, don't drink a lot. That is more for me. So I promise to maintain my alcoholic consumption to the minimum during my vacation time.
One quick question that was there was the benefit of the breathing exercise.
Or did I miss something?
I think Kathy asked the benefit of the breathing exercise.
Oh, yeah, right. I'm sorry. So Kathy, you probably were not there last Friday. So, if you, Buteyko is a Russian pulmonologist who developed this breath technique, and he was curing asthma and COPD with these methods. So this is a direct therapeutic effects, definitely most important for patients with asthma. If some of you here, if you're asthmatic and you were trying to do this and you're struggling even with like 10 breaths on the inhale, don't be surprised. It's one of the methods I've used personally for my asthma. And as I mentioned to some of you, I haven't had an asthma episode in decades, not in years, in decades. Probably the last one was like 20 years ago, maybe more than 25 at this point. Definitely, like, yeah, actually probably 30 already. So it was in the 90s. So yeah, so this is a very profoundly therapeutic methods. Kathy, if you want to learn more, I strongly recommend getting the book called The Breath by James Nestor. He has a whole chapter on Buteyko in there and how he used it therapeutically. And it's only one. Buteyko had like a half a dozen methods, but this one is the most important in many ways and probably most fundamental. There are other techniques that are a bit more sophisticated, I would say. Don't worry about that. I think there's something to be said about simplicity of this method. It can be done anywhere. It's also really good if you're in a stressful situation where it's a very anxiety provoking. If you engage into this, first of all, it's be hard. Like, let's say you're now doing comfortably 15-30. In the moment of anxiety, you like it to do 10-20. And so, but as you do, you will notice the body will start relaxing, just what Jennifer said. You may feel really sleepy and feel like, okay, I'll go take a nap. And if that happens, that's a perfectly normal reaction to acute stressor. In fact, if you look at kids like before age of 5 or 6, one of the most common natural reaction after an acute stressor, they just, and they're gone for an hour, whatever, they're napping. That is one of the best ways of dealing with this because it's a full activation of parasympathetic tone. But this does it too. You know, there are modified forms of this. Of course, there's a Andrew Weil method of 4-7-8 breath. It's basically the same thing. There's the 4-8. That's the key. The key is that ratio between inhale and exhale. The hold is put in there for slower breath all in all, and kind of to get body more accustomed to the holding patterns. Buteyko never recommended holding patterns for especially if you're treating lung disease. He was always very aggressive about just doing inhale, exhale continuously throughout. Kathy, I hope that helps. Okay. All right. Well, again, happy holidays, everybody. Glad you all stuck with us despite going over time. I'll stay here for a minute or two if anybody needs me. If you're my patient, you have personally questions for me, hang around. Otherwise, I'll see you in the new year. Janet, you stopped the recording, right?
Yeah, I'm about to.
Make me a co-host and bye.
Okay, okay, okay.
Have a good holiday, everyone.
Bye, Linda.
Bye-bye.
I'm so embarrassed by this. I can't find where the record is. Oh, there it is. All right. We have